Hi, welcome to the Fit and Healthy Today show. Today we'll be discussing brain health. I tried to compact as much information to fit into this short segment as I possibly can to give you information on what the brain is, what nutrients it requires, and what we can do to make it healthier and have better memory and better alertness. So first of all, I'd like to discuss what the brain consists of. What is it? It weighs 2 to 3 pounds. It consists of about 60% fat and cholesterol. The brain has a very high percentage of cholesterol, primarily found in the myelin, which are, they insulate the nerves and the neurons. When you look at the size of the brain, it's only about 2% of the total body weight, but it consumes 20% of the oxygen, 25% of the glucose, and it requires 15% of the blood cardio output. So for its little piece that it is, it requires an awful lot. Depending on how much you're using it, whether you're sedentary or you're sitting there doing a final exam, it uses between 0.1 and 1.5 calories per minute. It's the control center of the nervous system. It is not fully developed until age 25 to 30, and how it develops is it develops from the back to the front. So the frontal lobes, which are oftentimes our ability to distinguish right from wrong, making good judgment decisions. Hence, we see these 16-year-old drivers out there driving who don't quite have a completed brain until they're age 25 or 30. We do see some judgment issues that may not be fully developed. It is composed of 2 broad classes of cells, neurons, which we usually refer to as being nerves, and glia or glia. The nerves are similar to electrical circuits. They pass and send information, basically connected by biological fibers called nerve fibers. So if you think of the wires carrying the electrical current, it's kind of how your brain works. Each brain has estimated approximately 100 billion neurons, and each of those neurons is connected to 1,000 other neurons. So the combinations and how they affect each other is trillions of different types of messages that are being sent. Hence the need to keep the brain in very good health, because the miscommunication or misfiring or electrical shorts occur. So the glia or glia, Greek for glue, and basically what this does is it forms the support system for the nerves, for the neurons, so that they can travel back and forth. It cleans up and helps dispose of waste. There are 4 classifications of neurotransmitters that I'd like to discuss today. The primary ones are noradrenaline, dopamine, serotonin. When you're talking about these systems, each of them are responsible for different functions in the brain. The noradrenaline is for arousal and reward. Dopamine systems, which we oftentimes equate to like Parkinson's, the disorder where you'll see people shake, are your motor systems, cognition, endocrine system, and nausea as well. And then you have the cholinergic system, which is the learning, short-term memory, arousal, and reward system. They're all interconnected to each other. None functions without the other, supporting each other. So we really don't want to think of them too much as separate systems. They may have different functions, but they're not independent of each other. Okay. What can have adverse effects on the brain and brain health? And I listed probably what would be considered the most common things that will affect brain health, the most researched things, the things that we're aware from observation as well as research. Drugs, be them prescribed drugs or illegal drugs. And sometimes it's really easy to think, oh, the illegal drugs, the methamphetamine and those types of drugs, those are the ones that are going to cause all the brain damage. And yes, they do cause brain damage. The marijuana, they cause learning abilities, short-term memory issues, cocaine exciting the brain, overstimulating the brain. But there are other medications that affect memory that we have to also be aware of, and physicians need to be aware of, particularly if their patients exhibit signs of having memory issues. Beta blockers, blood pressure medications that slow the heart down and slow circulation to the brain. Certain anti-anxiety medications, painkillers, antihistamines, certain incontinence and depression medications can affect. And this is a brand new 2008 study. Some of these types of drugs affect endocrine systems to the extreme. Chemotherapy, new research out on that there basically is kind of like this brain fog. The brain just doesn't function oftentimes very well after chemo because the toxic exposure that the brain gets exposed to. We have something called the blood-brain barrier, which is a vast amount of very close-knit blood vessels and capillaries that attempt to try and protect the brain from toxins and chemicals entering the brain. But there's only so much that it can keep out, especially if there ends up being damage to this blood-brain barrier over a period of time, caused by further things such as toxic chemicals such as fluoride, mercury, which literally won't allow the nerves or neurons to properly replicate. So amalgam fillings, there's some wonderful research that's coming out on amalgams, and you can see, I mean, even on YouTube, they'll pull a mercury filling that's 20 years old and show the mercury vapors flying up from it. So mercury from fish, from amalgam fillings, the old silver fillings we got like when I was 16 years old. Pesticides and heavy metal exposure from certain types of field of work or from chemical pesticides build up in the brain. They're toxic chemicals that affect neuron replication and transfer of information, and as well as the neurotransmitter ability and time factors involved with that. So, poor nutrition and diet, polysaturated fats. Poor nutrition, particularly at the time in fetal stage, is, oh my gosh, that's the time when the brain is developing. And if we don't have adequate amounts of essential fatty acids, or we have toxic chemical exposure, or we have drug exposure, it rewires the hardware on the brain to where it will not fire properly, it won't develop properly, we end up with behavioral issues, learning issues. So nutrition and diet, as I mentioned before, 60% of the brain is fats. And so if we don't have adequate amounts of fatty acids to feed the brain on a continual basis, the brain kind of dries out, and we don't end up with very good communication or repair of the brain. Impaired circulation. As we mentioned, beta blockers slow circulation down, but in addition, the lack of exercise, the no movement, the poor circulation, blood sugars damaging the vascular system so that you cannot you end up with vascular inflammation, so that there's just not good circulation going to the brain. Anxiety, stress, and depression, these send out certain types of hormonal changes that will cause vasoconstriction, or literally send out, for example, under stress, the body sends out adrenaline and cortisol, which is kind of like battery acid going in on that vascular system, and it just kind of fries it over a period of time. So you end up with damage to the vascular system, including the brain. Food or chemical allergies. There was one study done where people literally had milk sensitivities, and they knew they had milk sensitivities, but they also had memory issues. And when they removed people off of these milk products, literally over a period of time, their memory, in some cases up to 30%, regained back again, short-term memory. So food allergies are something very much to be aware of because they cause inflammation, and that can mean inflammation in the brain as well. Alcohol and tobacco, there's a brand new study that just came out talking about its effect or their effect on Alzheimer's, increasing the risk of Alzheimer's. So smoking, excessive amounts of alcohol usage cause damage to the brain. Obviously, when you're raising alcohol levels, you're raising sugar levels, and you're exposing the brain to toxic chemicals. And the same that goes with tobacco. Maybe not so much the tobacco, but the chemicals found in the tobacco, which from what I've read are sometimes over 100 different types of toxic chemicals that you're exposing your body to, as well as your brain to. Okay. Focusing on the things that can help the brain when we're talking about everyday things that we can do. A diet high in raw foods, nuts, adequate amounts of protein. If you don't have adequate amounts of protein, the brain does not wake up. It just, if you see these little kids come to school with the Pop-Tarts and they're sitting in their desks, the brain does not wake up unless it has adequate amounts of protein. If you don't have adequate amounts of good fats in the diet, it affects sleep, learning, behavior, because once again, remember, the brain is 60% fats. So nuts, walnuts, almonds, pecans, fish, avocados are all necessary things for the brain. Since the brain is primarily DHA fatty acids, we require these fats for overall brain health. There was one study regarding sugar, avoiding high sugar diets, which the study showed a substantial decrease in recall when blood sugars were high, or when someone ate as much as one large bowl of pasta, up to 30% decrease in recall. So it's a pretty substantial amount. Getting actual good regular exercise, a good study, a 20% decrease in the risk of cognitive impairment in women who just walked 6 hours a week. 20% decrease in just a little bit of exercise, walking every day. So exercise is important. Getting enough sleep. If you don't have adequate sleep, nothing has a chance to repair. If a person's ever gone without sleep, I have, and I'm sure a lot of other mommies have when they have babies, you feel like a drunken sailor. It's just, you're off balance, you can't think or process information, so it's really important to get sleep. Keeping mentally active, be it always finding or learning something new, crossword puzzles, something different that keeps the brain excited and wants to continue learning is very, very important for keeping it active and focused. Lack of use, just like any muscle, it will not work properly. Just a neat little trick that I found in one study, holding your breath for about 30 seconds, 6 to 12 times a day. Just simple holding the breath can really increase, in a 30-day study that they did, mental or overall mental alertness, because it makes you conscious of your breath and your breathing. Okay, I'd like to get into a little bit of a discussion about the supplements that are out there and available that are very helpful for the brain. Since our brain is primarily DHA, it's the predominant fatty acid in the brain, the nervous system, the retina of the eye, it's very, very necessary, particularly during fetal and infantile development, that you have adequate amounts of DHA, fish oils, omega-3 types of fatty acids. A good multivitamin, high in antioxidants. One study supported a definite increase in short-term memory and cognitive function just by taking 200 to 400 IUs of vitamin E, 1,000 milligrams of vitamin C, and increasing natural beta-carotenes, carrots in the diet, the natural good oranges and yellows in the diet. Acetyl-L-carnitine, acetylcholine, phosphatidylserine. These are things that have been researched very, very substantially, even in the a wonderful good book, The Wrinkle Cure for Anti-Aging. But these are all things that help feed the brain and have found to be very, very anti-Alzheimer's. There's specific things that they do. Acetyl-L-carnitine is found in very high concentrations in the brain, and it supports the ability of the mitochondria or the fatty acids to feed in the mitochondria. So very important for short-term memory and recall. Acetylcholine, a recent even newspaper article by Dr. Gott was suggesting for cognitive function, and it helps the synthesis of acetylcholine in the brain. Phosphatidylserine. I know for me personally, phenomenally helps with my short-term memory recall, since the nature of my job is I have to learn a lot of information and give information all day long. Phosphatidylserine has been extremely helpful in helping my short-term memory, and I have a lot of college students that utilize this to help them as well. DMAE, precursor to choline, improves attention, mental alertness, and cognitive function. There are some very specific things that are utilized for specific issues as well. Vinpocetine, I have a couple of physicians that recommend it for stroke victims, and we've seen literally people who have been years down the road who would have the little face or the lip down, who after using vinpocetine at the proper dosage regain some of their movement and motion. So it seems to help with their neurotransmitters and their repair. Tryptophan helps correct alcohol-induced memory impairment, especially visual memory. And tryptophan is an amino acid that also helps with serotonin and sleep. So, thiamine, which is a B vitamin, 500 milligram dosage a day, restored memory in people recovering from cocaine addiction. Very simple B vitamin, 500 milligrams, a cheap little $5 or $6 item. So, CoQ10. Pine bark or grapeseed extract, phenomenal cellular protection, very strong antioxidant for the brain. L-tyrosine, especially when you're during stress or you're under a lot of fatigue. Tyrosine, battle fatigue is what I call it as a working mom. It helps with the energy levels and dealing with stress with the memory and focus. Ginkgo biloba, very powerful antioxidant that increases cerebral circulation into the brain, and it is a very good anti-inflammatory for the brain. Things like garlic, and believe it or not, a brand new study on coffee found to be extremely anti-Alzheimer's. Not necessarily the effects of caffeine. We're not exactly quite sure about it, but caffeine is probably one of the strongest, in one study that I read, one of the very few antioxidants that people get during the day when they don't take a good multivitamin. So there are other things that I could mention. The details run lengthy, but hopefully this will encourage you to further research other things that may help promote your overall brain health. Welcome to the fitness portion of our show, and today I'd like to show you a couple of abdominal exercises that I would like to be very specific about, how that you do them in a very controlled fashion, and if you feel any type of pain you need to immediately stop it, and then please first consult your physician before starting any of these exercises. First of all, I'd like to show you an exercise that works the top of the abdominals. And basically what you do is you put support behind your head, and you always want to support your neck, and you're basically just lifting up. If you have relatively strong neck muscles, you can put your hands out and kind of reach like this, focusing that you're keeping and holding your abs tight, nice and secure. But once again, I tend to like to put my arm or hand behind my neck to support my neck. And if you can do as many of these as you can and rest, 5, maybe 10 seconds, and then try as many as you can again. And then gradually working yourself up to where you can maybe do 15 to 25 repetitions for 3 sets. That means 15 to 25 repetitions 3 times. Lower abdominals, little poochie right here that we sometimes get as women, are just as important as upper abdominals. I see people doing crunches, but they sometimes forget about their lower abs. I like to put my hands underneath my butt, forcing my lower back into the floor, or better yet, a nice soft pad. And basically what you're going to do is you're just going to rock your legs back and forth like this. Okay? And what you're trying to do is you're trying to bring those abdominals up, once again, keeping those hands underneath your butt, working those lower abdominals. You may find this to be a little easier or harder, depending on what your abdominal development is, or what your fitness level is. We're going to be moving on to the next segment of our show, which will be Ralph Turchiano working on the latest, greatest research. Welcome to the research portion of our show. Today we have Ralph Turchiano to discuss the latest, greatest research.
Yep. And yes, here's a curiosity question. What would you do if there was a substance out there that reduced painful joints by 55%, joint stiffness by 56%, and increased mobility by almost threefold in at least 53% of the patients who took it? Chances are, if you were the American Arthritis Foundation, you'd probably go out there and promote it, but it has not been. What this item is, may be interesting to find out, is French maritime pine bark. Something very simple, hardly any side effects, or at least no side effects recorded unless you're allergic to pine bark, and extremely efficacious. It was a good study. What they took is 100 milligrams of pine bark and did it about twice per day. Now this was a double-blind, placebo-controlled study, and it was confirmed in a prior study through one of the colleges earlier. Very effective, very cool substance. In addition to that, it was shown in patients who had edema or swelling around the ankles, it actually reduced that by 79%, as opposed to the placebo group who only had a 1% reduction in swelling of the ankles. Very cool study, and again, it has been duplicated by other sources, so it's been shown to be very promising. And here's a curiosity question, or I should say a new twist, which I would not have expected. High blood pressure may protect against migraine. This was done through the Medical Journal of American Academy of Neurology. It was tested over 51,000 men in Norway. The study found people with higher systolic blood pressure were up to 40% less likely to have a headache or migraine compared to people with healthier blood pressure rates. In addition, higher pulse pressure was linked to up to 50% reduction in the amount of headache and migraine for both men and women. Now, what the study is saying through the Neurology Association, American Academy of Neurology, is Chodnovic, which is the researcher, says the results confirm previous studies which have found that increasing blood pressure is linked to decreasing amounts of chronic pain in all parts of the body. Real interesting information in regards to blood pressure. Sometimes what you think is the enemy ends up being a friend. I wouldn't recommend going and getting high blood pressure to reduce pain, but it does make you think that sometimes we don't know everything. And here's another one to think about. If you have a pneumonia, it'd be highly, highly recommended to stay away from automobile exhaust. What they discovered in the Journal of Epidemiology and Community Health is that the death rate from people having pneumonia that are around automobile exhaust skyrockets. They drew a direct connection. Did not give percentages, but at least in England they said it resulted in an additional 15,000 deaths per year. And they found out that the automobile exhaust does direct damage to the lung tissue. So when your lungs are already strained with pneumonia, the automobile exhaust is not going to help much. So if you have pneumonia, child, adult, or family friend, stay away from automobile exhaust. And then, what would you do if you found out that you could prevent breast cancer? Now, would you, if you're a media organization, would you promote it or advertise it? Or at least tell your audience about the ways to prevent it? Well, Michigan State University, the National Cancer Institute, and the National Environmental Health Services found out that does not happen. In regards to basically media coverage of breast cancer prevention, which can be caused by environmental, chemical, stress, hormones, you name it, only 18% of all news stories had anything to do with prevention. In fact, 82% just had to do with treatments. The reason this was a concern to the National Cancer Institute and National Institutes of Health was the primary reason it's giving people the false impression that by the time they get cancer, there'll be a cure, that a cure is around the corner. I think all of us are familiar with this from back from the Nixon administration when the war on cancer was originally committed to. Obviously, it's one war which has not really come to fruition yet as far as benefit or basically treatment. Now, here's another one. Now, we all know what happens in school if someone else does our homework and we sign our names to it. Usually if it's a science project, elementary school, college, plagiarism, whatever you want to call it, you usually get kicked out. Well, what if I told you that a lot of the medical research that you've been reading that has the names of prominent researchers on it, those researchers never, ever read the story. In fact, those researchers get paid to put their name on the story, even though they never did a dime of lab work. Well, what's happened right now in the Medical Journal of Editors basically found out it's happening rampant, and they condemned the action. They can't seem to stop it, and so the Journal of, the Journal of General Internal Medicine. But it seems to be going on left and right, and they don't seem to coming to an end anytime soon. So, a word of caution: when you see medical research and you see certain names on it, don't necessarily count it as a gold stamp. But what we find is inappropriate and unexcusable for our children and our students, we find perfectly acceptable in medical journals and in research work, which is to me atrocious considering the fact that people's lives depend on this stuff. For any researcher to give his name to a study which he never even bothered reading and getting money back in exchange for it, well, I'll let you be the judge. And now, here's another one. Now, what we find out, well, let's back this up a little bit. What if there was a drug that was approved as a cough syrup, and it worked fairly well? There's a study done, double-blind, crossover placebo, and it got approved. Now, what if I told you that that company, or those doctors, or that hospital could end up using that cough syrup as a chemo drug without ever having any repercussion, without having any scientific basis, literally just done so they can make $5,000 a treatment off of giving you a drug, which basically is no more than a commodity to them? Well, it may just happen. Stanford University found out that the FDA plans to reduce the oversight, of off-label drug use, meaning they can do that. They can research a drug for one thing and use it for something totally different. And what happens, they found out that the FDA has just basically given up. So generally, what happens if it's cheaper to do a drug trial, let's say on sinus medicines or hair coloring or whatever it is, that the drug companies can be more prone to do the cheap medical study, get approval, and then use that drug for anything else. In fact, what they've found out more than anything else, in 2006, when they actually looked at it, they found that 73% of all off-label drug use had absolutely zero, not little, zero scientific backing for it being used as that. It doesn't mean that it's not okay to experiment and try new venues and options, but however, the patient and the doctor should be aware of it. And thank you.
Thank you very much for joining us today, and we hope that this information will provide you or encourage you to research further regarding brain health and other information. Thank you.